Before we get into our live Q&A today, looks like I already got a bunch of questions and about all things Social Security, retirement, disability, survivor benefits, spouse benefits, Medicare, Medicaid. Before we get into all those questions, let's talk about the story of the day. It Finally, Social Security, after begging Congress for decades, we need to update the Social Security system. We need to update the computer system. It's based on 1970 COBOL and Fortran technology. We need to update it. Congress has continuously refused. Well, they finally, this is last year, Congress allocated $1.5 billion. It's a big project, one of the largest databases in the world. So they allocated money. They assigned a company to do it, a company that has been dealing with Social Security for a while and doing other minor projects. So they know Social Security, they know the databases and all the rest of it. Well, and then Doge came along. So the Doge canceled that contract with that set of companies that have worked with Social Security for years doing this type of stuff, and they gave it to, guess what? A Doge company. So, fine, the Doge company they gave it to also does Department of Defense and does some other. They're a big player, and they've got a lot of AI that goes into it. So they're advanced technology. So I'm not a super computer whiz. So I'm not exactly sure of whether this company is better than the previous company they chose or whatever the case may be. But be that as it may, there's a new company that's taken over, and it's a Doge decided company. And I want to give some points to that company that is looking to go into Social Security, and also to talk to people out there that we need to make sure that it's transparent, that we have public oversight, congressional oversight of this, because this is our information, this is our data. Social Security has been very good. Let me knock on wood there. Social Security has been outstanding, as we used to say in the Marine Corps, outstanding in terms of protecting Social Security data. Anytime you have heard of Social Security numbers are on the dark web or released or this, whatever, it's usually 99.9% a private company. A hospital, a credit card company, LexisNexis, I think, just got a few $100,000 that they lost. Some other credit reporting agencies, or whatever the case may be, department stores. Those are the ones that usually get exposed and get our information out, our names and date of birth and Social Security number and credit card numbers and address and all that kind of stuff. Social Security, again, knock on wood, has not had a breach like that. And people say, well, the Social Security numbers are out there. Yes, that's because everybody uses Social Security numbers. They never should have. Social Security numbers should be for Social Security. But for some reason, for decades and decades and decades, everybody has used Social Security numbers as the default, number. But that is not Social Security's fault. It should have never happened. That's congressional fault. Decades ago, Congress should have said, "Hey, no, credit card companies and all that. You can't use the credit card. You can't use a Social Security number for your, databases. You have to pick something else." But that doesn't happen. So I remember when I was a young man in the Marine Corps in the 1980s at our barracks. In each room, it was me and Lance Corporal Rankin and Sergeant Smith, and it would have a little a card on the outside so everybody could see in the little window there, and it would say Sergeant Smith, date of birth and Social Security number, Private First Class Weir, Social Security number and date of birth. So that was it was a different time. But anyway, weed now is different, and this new computer system, this new computer company, congressional oversight is needed. Transparency is needed to make sure that this information doesn't get out there. It's not part of some type of general database on all human beings, on all Americans. And one of the things that kind of is an issue right now is the knowledge gap of Doge. They don't know Social Security. If you've been paying attention to the news or watching my channel for the past few months, you can tell Doge doesn't know Social Security. Elon Musk kept going out there and say there's millions of deceased people that are receiving benefits, which we've talked about a million times. It's not a fact. I did a video on this yesterday, and people say, so I did a video on this yesterday, and some people came in there and said, okay, where's the proof that they didn't find fraud at Social Security? So there it is. Just go on to the Department of Government Efficiency. So it's doge.gov. And you can look on there, and they make it very difficult to search. There is no search button where you can type in Social Security Administration. You can't click on it. You click on the agency. Let's click on Social Security, and nothing pops up. So it's very, very difficult to find anything on this website. So I don't know who designed this website, but it's a terrible website. Usually you click on this little thing, agency, and it'll give you, alphabetical order of it. So I'm not sure why they're making it so, well, I know exactly why they're making it so difficult. But anyway, all you have to do is look on their official website, and you can see Social Security. You'll have to spend about an hour or two looking through each of the pages. So we've got about 1,000 pages there. And if you find any fraud that Social Security committed, or that the Doge found, then let me know. But it doesn't exist. It does exist. As I mentioned millions of times, there is fraud in Social Security. People receiving disability benefits that shouldn't be receiving disability. They're not disabled anymore, or they're working, they're able to work. That fraud Social Security employees find every single day. But Doge was unable to find fraud because they were looking at all the wrong places. They were looking at millions of people that are supposedly deceased, over 120 years old. I said, you're looking at the wrong database. They're talking about 40% of calls coming in are fraud. No, that's way, way wrong. It was about 0.002%. So they really need to get up to speed. They need to ask someone and learn about the Social Security Administration system before they start going in there and redesigning the system. So we need to make sure that whoever is on the congressional oversight, that they know what they're doing before they start pushing buttons and changing everything. But it is a good opportunity. I always like to stay positive, as long as they do the right thing, do it effectively, make sure we don't lose our benefits, make sure we've got data privacy out there. Again, Social Security has been very, very, very good at protecting Social Security numbers and records and stuff like that. They've never had a major leak of that type of information. When they redesign the system, it seems as though their number one focus is going after fraud. Okay. Again, the fraud is, people receiving disability benefits that are working, SSI benefits, supplemental security income, which is the needs-based program the Social Security administers. That needs to be addressed. Obviously, there is fraud there. So if the computer system can help Social Security employees find that fraud even better than what they're doing, then perfect. Everybody is good for that. But they shouldn't miss the important thing. And basically, for all those haters out there, you will be happy when I say this. Hopefully, Doge replaces me, and Doge makes me obsolete. Well, my wife says I'm obsolete for a long time, but anyway, Doge finally. Ed, you don't need to make videos anymore helping people, navigate their bureaucracy and make sure they get everything they are eligible for, entitled to, and need, because the computer system is an awesome computer system, and we're going to make sure nobody misses the benefits they're eligible for. And the day that happens, bye. I'll be gone. I'll go back into retirement. It's better to fade out than anyway. So that is when you reach out to your congressional representatives. Tell them, hey, we think Social Security information should be kept in Social Security. It shouldn't be shared with other agencies. If you believe they should be shared with other agencies, the one giant database, then I guess that's your prerogative to contact your congressional representatives and tell them that's how you want it. But fraud, go after fraud, make sure they're doing it correctly, make sure people don't lose their benefits, and probably the one focus that hopefully they really need to focus on is making sure people get the benefits that they need. The entire thing has been done backwards. They have let go a lot of Social Security employees. just when the baby boomers, about 11,000 baby boomers, are turning 65 every day. So there's massive demand for help to get benefits. And then they cut staff to prevent people from getting those benefits. And there's hours of wait time and stuff. So what they should have done is update the computer system. If you're going to bring in AI, which there was a report on AI in the phone system and it was terrible, whatever the case may be, if they're going to update the system, make it more efficient, make it easier to navigate, then that's great. And then once they do that, then they start letting employees go because they don't need those employees. Then that's the smart way to do it. But they did it completely opposite, which makes no sense whatsoever. All right. So reach out to your congressional representatives and make sure your voice is heard and make sure this has stayed transparent and congressional oversight. Okay. All right. Let's get into your questions. Let me get all set up here. We got tons of questions already. Let me see here. And we've got hundreds and hundreds of questions. And obviously, I'm not going to be able to get them to all of them. Lori, can we keep it to questions? Dr. Ed devotes time to help people understanding with a problem. It's not a chat to opine about thoughts or government political feelings. People get pissed. Well, yeah, you can put that in the description after it, but it's important. There it is. That we help people get the benefits, and we also want to make sure people get involved to make sure those benefits don't get cut, which unfortunately they are going to be cut if we don't do something in the next few years. We've known about it for decades and we haven't done anything up until now. So, all right, let's see here. My question is for my mom. Awesome. Our first hero of the day, looking out for other people. Awesome. Thank you. My question is for my mom, who is 58 years old. If she collects spousal benefits at 62, will this decrease her widow's, or she can have 100%? Okay. Spousal benefits at 62, will this decrease her widow's? So she's already getting widow benefits from another person? All right. Yeah, I'm not sure. Okay. So for spousal benefits, yeah, you can start spousal benefits at 62 years old. You have to file for benefits on your own record first, and then you can file for spouse benefits if the numbers, if your benefit amount is less than half of the other person. But if she's already receiving widow's benefits from a previous spouse, then she probably those will stop because it sounds like she's remarried. So if you're receiving widow's benefits and you remarry, that pretty much stops. You can remarry after 60, but those two statements don't work out there. Sorry. Why am I going to be taxed on my retirement? Yeah, good question. That 1980s, that was started as part of, when the trust fund was started in the 1980s, they did a bunch of things. They raised the retirement age, but they also added taxes on Social Security. The current President Trump said that was one of his campaign promises, to end taxes on Social Security, but it's not anywhere in there. So I heard that Doge is once again back in the Treasury system. Can they change Social Security payments? Yeah, the Treasury system is completely different, but the Social Security Administration tells the Department of Treasury to cut the check. So Department of Treasury, there's one giant bank account where all the checks come out of, and Social Security says, hey, cut this check to this particular person. So Treasury technically can't, well, I'm sure they can technically, but I don't think that would happen. They just issue the checks. And Elon Musk, another incorrect thing he says is these don't have any codings to know where they're going. Yes, all Social Security checks have codings. C1, C2, B1, W, A. Yeah, it's at the end of the Social Security number when you get a check. So again, these people really need to get up to speed on how Social Security operates before they start messing stuff up. So I've volunteered dozens and dozens of times and sent emails and through X and Twitter and says, hey, if you need help, reach out to me and I'll fill you in on what needs to be done with my experience. And crickets. Nobody's interested in talking to me. Furthermore, the database collecting info is unconstitutional. Having this master database. with anything else, stuff like that can be used. That's I have reservations about having one giant database on all Americans. So I'd rather have a human determining my eligibility. Yes, I agree. Because there's just so many variables. And, this is something you do, once in your life. I've taken hundreds of thousands of retirement claims, survivor claims, disability claims. And, this is a milestone in people's life. They finally made it to 62 or 65 or 67. And they want to talk to a human being for 15 or 20 minutes. What's wrong with that? AI is a threat to humanity. It is supposed to be used as a tool, not to take the place of real people. Yeah, that's one of the definite issues. Why Social Security is going to be cut in a few years is obviously because the Social Security Trust Fund is being depleted. It wasn't stolen. We got to be serious about this. It is there. It's just being depleted. It's being put in your paychecks every single month. But that money is going to be running out. And about 2033 or 2034, we're looking at about 20% cuts to everybody's Social Security check if we don't do anything. Because this much comes in, that much goes out. Right now, the trust fund covers that gap, but that trust fund is being depleted and there's nothing to cover the gap. And now I think the gap is going to get wider because of AI, because people are going to be losing their jobs and people don't pay FICA if they don't have a job. So it's going to be an interesting decade. So thank you for all your help in these crazy times. You are welcome. Thank you for that comment. I appreciate it. How can I find out if I have lost my Medicaid coverage? Call Medicaid. That's definitely one way to do it. I just added a new section to my website. So my website is mygovexpert.com. And the new section that I just added a couple of days ago is on Medicaid. So you go in there and there's everything on retirement, disability, survivor benefits, family. I'm working on a section on SSI, supplemental security income. But there's a section on Medicaid. What is Medicaid? How to apply, how to keep your coverage, and all the rest of it. So I would reach out to your Medicaid. Once that budget passes, the big, beautiful bill, there's going to be a lot of people that lose Medicaid, unfortunately. Lose health insurance. Medicaid is health insurance. So a lot of people are going to get kicked off health insurance and they're low income. So even if they're working, their employers don't provide health care. So anyway, so if you don't know, call them up. But also, if you think you're losing Medicaid, you can definitely, people can lose it. But there's also cases where it can be downgraded. So when you call them up, say, hey, do I still have my Medicaid? And is it still at the same level it was before? Because different levels determine different things. If you're at the higher levels, they're called, Medicare savings program. It'll pay for your Part B of your Medicare if you have Medicare at the same time. Again, you can go onto my website and then click on the Medicaid and Medicare little tab there, and it tells you it's called dual eligible for those people that have Medicare and Medicaid and how they work together in the different levels of Medicaid. So check with them about that. If you can't get through for whatever reason, you can also reach out to Chapter, and they have access to the Medicare website. And through the Medicare website, quite often it tells them if you have Medicaid and what level as well. And then you can also, you may, if you have a Medicare Advantage plan, if you have Medicaid, if you're losing Medicaid, then you have a special enrollment opportunity where you can find another Medicare Advantage plan, or maybe go to a Medicare Supplement plan, which are the ones I always recommend. But it's a budget type of issue. So why don't they change the ID number for us? Start over. Yeah. Or ban other companies, private companies, from using the Social Security number. So, but they are coming out with that digital Social Security number, so you don't necessarily need the little paper one anymore, or theoretically is what they're saying. So that won't start until later this year, but they're still working that out. Social Security has been very good with all of us until the unfortunate government came in. Why? What is their end result? Well, seeing what's going on, the answer: greed, control, and dollars. Yeah, follow the money, right? And this has been a plan. This is nothing new. Kind of the destruction of attack on Social Security. This has been going on since 1935. But the current plan was written up in the 1980s, and I have a copy. If you go into my YouTube description, it says it has the document in there that's the blueprint for exactly what's happening now, where they attack Social Security, call it incompetent, and talk about all these 20 million people are receiving Social Security benefits that are 200 years old, and see Social Security is so incompetent, making up all these BS stories so they can attack it, erode public trust, and so they can give it over to their buddies on Wall Street. So this is the plan that's been going on for decades, and we keep falling for it. So I was having trouble, but my audience, doesn't fall for it. So I was having trouble with the screen going blank when an ad came on. I tried rebooting it, but it only stopped the problem temporarily. Yeah, I'm not exactly sure what's going on. Yeah, someone said they were having that problem yesterday, but they said it was localized. This is all my videos when I do a live. All of like this one right here, it will, as soon as we finish the live today, it will pop up just like the one did yesterday. So every time I do a live, immediately after the live, it's there as a recording, so you can watch it anytime you want. So if you go to the home page there and you click on videos, and people click on videos, and those are the not the live ones. So those are just regular videos that actually my son, most of those he put together. But the live one are those hour ones I've been doing for quite a while. So you can watch these in a recording and fast forward all of the boring parts, which are pretty much the entire thing. So anyway, we need nods to block the trolls. Okay. Yeah, I try to. This is just me. We're fully exposed here. So people type what they want to type, and so I skip them if I notice them. I'm currently on Social Security disability and 65. When can I collect 100% of my deceased, divorced ex-spouse's benefits? Also, they still do the disability reviews after 65. Okay, good questions. So you're on Social Security disability. 100% of surviving spouse benefits is once you hit your full retirement age. And full retirement age for surviving spouse benefits is a little bit different. It's a few months different than full retirement age for regular retirement benefits. But I would call Social Security, because you're 65. So you can receive surviving spouse benefits now. If it's more than your disability, you'll continue to get your disability benefits. And just if you're entitled to more money in survivor benefits, that extra money will be added on top of your disability benefits. So what I would do is if you're not sure of the numbers, I would give them a call now and say, hey, I'm 65. I'm entitled to surviving divorced spouse benefits. How much is it? And then they'll give you the numbers. You probably have to, because they don't know who you are, whether, you're just trying to get somebody's information. So you might have to provide a marriage certificate, divorce decree, or something like that in order to get the actual details. But you get that information, and then you say, hey, if I wait until my full retirement age, my surviving spouse full retirement age, how much is it going to be? And they'll tell you, oh, it'll increase $100 or $200 a month, or whatever the case may be. And then you can make that decision. So do you want to wait an extra 2 years to get the extra $50, $100, $200 a month, and miss out on all those checks between now and then? Or do you want to go ahead and get those checks now? So that's a decision that you should probably, at least kick around right now. A lot of people, oh, I wish I would have known that last year and I would have taken it earlier, but they didn't. In terms of the continuing disability reviews, yes, technically, again, for all of those, you go onto my website, again, the disability part there, and click on continue reviews, and it gives you tons of information. Yeah, on all of that. So obviously, once you hit your full retirement age, you no longer receive. But in your 60s, you could very well. So it has all the information, yes. But it's a budget issue. Whether your particular local district office has a budget to do CDRs, that's a whole different issue. So even if it's your turn this month to do your continuing disability review, if the local office doesn't have the budget, if Congress didn't give your local office or Social Security the budget to do a continuing disability review, you ain't getting one. So I bet you Musk has a click button on his computer to look at you anytime. Yeah. Yeah, I was, I was rooting for him. I was rooting for Doge and Musk and everything like that. And it's like, hey, these are computer guys. They're going to come in there and do the computer. And so they're doing that, but they just need to be more educated and learn about Social Security system, because they've done so many mistakes and just mistake after mistake after mistake. The zombies receiving benefits, 40% of this, the 1.3 million people on Medicare or Medicaid that are, non-citizens. Yes, if you're in this country legally and you paid into it, you can get Medicare. Okay, we're going to cut overpayments from 10% to 100%, and then they changed it within a month back to 50%. We're going to make everybody come in. Okay, we're not going to make everybody come in. We're going to, stop your benefits if you don't call in. Okay, we're not going to stop your benefits. It's just there's so much fraud on the phones, and then they go through 110,000 calls and they find no fraud, and so they just need to get up to speed. So if I have health insurance for an employer and decline Medicare Part B, how does that affect Medigap enrollment later when I retire and start Medicare Part B? Good question. So you will be in a special enrollment period. So once you start Part B is when you should start kicking around your Medicare Supplement plan. I've got on my website there, it has the special enrollment period and Medicare supplements and all the rest of it. And it has all the forms too. So once you stop receiving health insurance from work, I'm still working on this video here. The video is not up there, but in the enrollment periods, it tells you, so you will be in a special enrollment period after, losing your job, quitting your job, and you just need to fill out these two forms, the 40B and the 564. And guess what? I've even got those forms with links there for you. And the 564, it tells you how to fill it out, where to fill it out, where to send it in and stuff like that. And then you can reach out to my partners at Chapter and they can help you find a Medicare supplement in your neck of the woods, 100% free. So, and they support this live Q&A. So it's a beautiful thing. For Doge, like bad apples to him means everyone. That's the problem. It has to be an honest person's in this administration. Yeah, just like any other organization. No organization, itself is necessarily good or bad, I guess, like that. But yeah, it depends who makes it up. So why would you be positive about this, Doc? I just try to stay positive. Yeah, it's just if it's an inevitability, if Doge is going to be in charge of picking the computer system and the company and getting it, it sounds like it's a done deal. So I guess we just have to make the best of it. Is it what I would have chosen 6 months ago? No, but it's reality. So. What a great blessing to us for all the info you give to us. Thank you so much. You're welcome. Thank you very much. I appreciate it. Tweety Bird, what's up, Tweety? You would think those Doge boys could make a more efficient way to look up stuff on their website of waste frauds if they saved. Yes. Thank you. I don't think I talked about that enough when I did the first part, because Social Security has less than a 1%. 1% error rates, incorrect payments. And this is bear true for decades for the Government Accountability Office and Inspector General and all the 1%. So, I mean, you just look at it, around your neighborhood, you probably know, 99 people that are receiving, retirement benefits or disability benefits or children benefits or something like that. But out of that 99 people, you probably know one person that's, okay, that person receiving disability, they could probably work, So that's that one person out of, Um, so what they really need to do is help people stay out of trouble. Predominantly, the big things that people get in trouble for are disability. When they're receiving disability and they work, because they are allowed to work, because we want people to try to go back to work while receiving disability benefits. But working and getting disability benefits is just so complicated. So that's why I did a guide here and also a calculator, and it tells you about the trial work period and stuff like that. So if they can help people help themselves, I think that needs to be a major, major part of the computer system to make sure people don't get overpaid, or underpaid. So I think that has to be a key component of whatever system they design and they come up with. So let's see. Okay, let me see. Get some new people here that I don't recognize. Why are they making it so very difficult to find out any information on that website on anything about Social Security information? I have no idea. When I first went in there to the wall of receipts, the doge.gov official government website, I'm sure when you first went in there, it was a lot easier to navigate. You could click on the little titles and it would, alphabetize everything. They stopped doing that. Why? So um, I'm sure you know why. AI is not yet reliable, and I work with it. It still has some way to go. Yes, 100%. I have typed stuff into AI, and I, pretend like I'm, looking to file for Social Security benefits, and I ask AI about it, and then it tells me, and it's 80% right. But then I say, okay, well, what about this? And they say, oh, yeah, okay, I forgot about that. Yeah, you should also consider that as well. So yeah, it's not there. Yeah, it definitely ain't there yet. So definitely, watch out. New Social Security will find less fraud because the humans needed to go out and investigate won't exist. Already fired many. AI can't go physically investigate unless androids are invented. Yes, that's the irony of all of this is Doge is their number one thing is, to find fraud, waste, and abuse, but they didn't find anything. They didn't find any fraud. And the people that actually are finding fraud every single day, they're letting go. And they're saying, yeah, we don't need you anymore. Vacate the premises. And so there's actually going to be an increase on fraud, disability fraud, SSI fraud. Again, I use the word fraud, incorrect payments, because a lot of these, a lot of people just, they are unaware of the difference between a trial work period and a SGA and a, IRWI and EPE versus, so yeah, that's why I built all the guides there. So, and my husband wants to stop Social Security removing 10% for federal taxes. He filled out the form and they made him just drop it in a box. He's retiring and doesn't need this money taken out of his check. Okay, so that's the the W-4V, the voluntary tax withholding. They just changed the regulation on that within the last 6 or 7 months. So if this isn't done quickly, or even because before you had to fill out that little W-4 and say, stop it or start it or whatever the case may be. And Social Security had to have a paper copy, but they changed it within the last 6 months or so that we can call the 800 number or a local Social Security office and do it over the phone. So if he wants to, get that 10%, stopped immediately, then and he's not sure whether they're going to take action on that paper form, then have him call. And they just might say, "Oh yeah, somebody just pushed the button yesterday and it's done." So, but at least that it's stopped. When it happens, better 6 foot under, but yes, that really do their job right. Human beings, yeah, not AI. Yes, we are still social animals, aren't we? We like to talk to people. Are you going to keep going on about Doge? Yeah, I think today's topic was about Doge, and people have questions about Doge. So yeah, I'm if you want to talk about disability or survivor benefits or anything like that, absolutely, we can move over to that. But that Doge seems to be what people are talking about. Dr. Weir, please have a wonderful, blessed vacation next week. Yeah, thank you. I appreciate it. Yeah, I'm actually taking a couple of days off. So let's see. My supplement went up $6. Just got the letter. Supplement G. That's not too bad. So that's not too bad. So remember, so supplement G, try to keep that as long as you possibly can. Because those supplement plan, the Medicare supplement plan, no prior authorizations, no networks. You can go to any doctor or clinic or hospital that takes Medicare in the country. You don't need any second guessing from insurance companies. If the doctor says you need it, you're done. So yeah, try to keep that as long as possible. Some people, if it went up $60 or something like that, then people are so, I can't afford it anymore, and then they start switching to Medicare Advantage plans with all those limitations, which just it's better. Medicare Advantage is better than having nothing at all, just Medicare Part A and Part B, unless you got a few $1,000,000 under your pillow or something. Let's see. My neighbor helped by chapter. They were able to get her a Sup Plan G and a Drug D Original Medicare. Recently found out she qualifies for Medicaid. Medicare loves Sup Plan, doesn't want to lose because of it. Okay, so if she's eligible for Medicaid, she needs to stop the Medicare Supplement Plan because her Medicaid essentially becomes, it depends on the level, but her Medicaid essentially becomes the kind of the primary that fulfills all the gaps of original Medicare. So on normal circumstances, what she can do is kind of suspend the Medicare Supplement Plan. And then if she loses Medicaid in the future, then she should be able to return that. It really depends on your particular state. I would reach out to chapter, and they will have someone that's an expert in that particular state, wherever you are, because she'll needs to get, stop the Medicare supplement. Because basically what it is the reason you're not allowed to have a Medicare supplement plan when you have Medicaid is because, Medicaid pays everything Medicare doesn't pay. So to have a Medicare supplement plan that you're paying, let's say $100 a month for, that company's making out like, crazy because they're like, hey, you're paying us $100 a month, but we don't have to do anything because Medicaid's paying everything. So the government said, nice try, guys. You can't do that. So you essentially have to stop that Medicare supplement plan. So you can reach out to chapter, whoever, and say, hey, I just, started Medicaid. Am I eligible for the higher levels, the Medicare Advantage dual eligible plans? And what happens to my Medicare supplement plan? I definitely want to be able to keep that in the future in case something happens. So yes, definitely, get that address sooner rather than later. Ed, can I write to my congressman about getting my second denial for SSI being a 63-year-old disabled woman? Yes, you can go on to the call up, and so you got your second denial. So make sure you actually go through the Social Security process first. If you got your second denial, so that means you're in the administrative law judge stage of the appeals. And I've got my new section in on appeals there, the 4 levels of appeal. So you did the reconsideration, and now you're doing a hearing with the administrative law judge. And I think my link is working. Yep, there it is. It's the HA 501, the request for a hearing by administrative law judge. And it looks a lot more intimidating. It's just only 1 page there. So yes, so definitely submit that. And once you get all the paperwork done, then you can reach out to your congressperson and say, okay, I just submitted it, and I know there's a year wait to get that looked at by administrative law judge, which is completely unsatisfactory. What are you doing, local congressperson, to improve customer service so we don't have to wait? People like me don't have to wait a year to get a decision like that. So, and you can go onto their website. So you go on to the whatever politicians, one of the 2 senators or your congressperson, and there's a link on all the websites that says, I need help with a federal agency. So you can do it there, or you can just call. So I'm still getting emails about maintenance of the Social Security website with no being date of end date. Then when I do get on my state, it won't let me print from it. Wow. Yeah. Yeah, I know the Social Security website has been down quite a few times over the last few months. And you know, no people know on the inside why, but it could just be, it could be Doge messing things up, and that's why the Social Security, website has been down, or it's because people are freaking out about Doge being in there, and a lot of people are accessing it, and it's just, being overloaded. So, yeah, it could be either one of those. So, you can't control what happens, so stop talking about it. Just answer questions that these people have. Okay. So we should just shut up and wait for our corporate overlords to make our decisions for us. You are in the wrong place. Can I apply for survivor benefits 3 months before I turn 60? Absolutely. Yep. Yep. That's about when you do it, about 3 or 4 months. File for survivor benefits. So you'll need, obviously, the marriage certificate or the divorce decree if it's a divorce type situation. If not, you probably don't want it. If the person was passed away in the United States, then the Social Security has that record of their passing and stuff. So absolutely. But you cannot file for that online. It has to be over the phone, or schedule an appointment in a local office. So we want to help everyone. Remember, if we don't take care of all of us, no one will. Thank God for a dedicated official like Dr. Weir. Oh, thanks. Yeah, I appreciate it. My husband and I are full retirement age and collecting on our own records. He collects about $400 more than I do. Should I apply for spousal benefits on his record? It really depends. If he's only about $400 more, it really depends on your benefit amount. But your full benefit amount, your PIA, your primary insurance amount, the amount you would receive at your full retirement age, has to be less than his full benefit amount, the PIA, the amount he would have received at full retirement age. So yes. And then on my website, you go on the family section there, click on the little family one there, click on spouse benefits, and then it actually has a spouse benefit calculator. And it'll tell you if you're entitled and how much you would be eligible for benefits on that person's record. So that's what a lot of people make mistakes is they say, "Oh, my benefit amount has to be less than half of my spouse's or my divorced spouse," and then they look at the wrong number. They look at the MBA, which is the monthly benefit amount, the actual amount of their check, and they say, "Hey, Bob, my benefit is $800. How much is yours?" "Oh, mine is 15. Oh, okay. I guess mine is not less than half." But they're looking at the completely wrong numbers. You might have filed at full retirement age. He might have filed at under retirement age. So you don't look at those numbers. You have to look at the PIA, the primary insurance amount, the amount at your full retirement age. So there's a lot of people out there missing money because they're looking at the wrong amounts. So please subscribe and like and share and all that kind of good stuff so more people get this information. So he just talked about a software upgrade, and then we can't respond to that with a comment. Nothing wrong with comments for others in the chat. For him to respond to, it's better to be all things Social Security. Okay. Yeah, it's going to be a massive Social Security update. Again, Social Security has been begging for decades for this, so they're finally getting it. So that's a good thing. But it's going to take years. I've seen they are going to be rolling it out. And that's hopefully what they do, because in piece by piece, one little thing at a time, because if, the system is it's just a beehive of mess, because Social Security has been begging Congress for decades. We need to update the basic overall system. And Congress says, here's $5, see what you can do. And then Social Security has been taking out some, duct tape and string and just, piecing it together piece by piece. And it's one of those things like a sweater. If you pull one little string in a sweater, thread in a shredder, the whole thing, just falls apart. So hopefully they do things slowly, methodically, but they're looking to get it all done by 2028. So you might have to tolerate me for another 3 years. Hello, Ed. Such an easy fix. Smash the cap. Raise the one-time benefit limit too. Yes, yes. In order to prevent those benefit cuts to everybody in a few years, then the trick is to smash the cap. Absolutely, absolutely. Choice. Can you explain federal quality review? I'm on step 3 of 5 on a reconsideration. I called, they said they made a decision, but it couldn't tell me on the phone. Okay. So yeah, the QR office. So sounds like a disability, but usually it's a disability type situation. You file for disability at your local Social Security office. They review it and get all the information, do all the technical, check out all the technical type stuff. Are you insured and all that kind of stuff? And then once they do that, they send it to the DDS, Disability Determination Service, the state agency that makes the decision. And sounds like they made a decision. And then they send that back to your local Social Security office to, push the button, adjudicate the claim, either approval or denial. But along the way, quality review randomly picks out some of those, just check quality review. So that looks like what happened. They picked your case out by random, so it's nothing personal. They just do it by random, and they're looking at the case to see whether everybody made the right decision. So, but cautionary tale. I've had a few of those cases that were intercepted by QR, my cases that were intercepted, and then there was some little technical thing that the DDS, the state agency, forgot to do. Oh, you forgot to check this box, or just some stupid thing, and then they would send it back to get that box checked, and then it would fall through the cracks. So I would call up after about a week or two and says, "Hey, what happened to that case?" Oh, it went to a different person, and that person's on vacation for a month, or that person just got fired by Doge, and so what I would do is, if it's been about a week or 2 or 3, I would call, not Social Security, call the DDS, the Disability Determination Service, because if it got back to Social Security, then it's good. So the Social Security employee won't know. Call the DDS, Disability Determination Service, the state agency. You can find the number in Google, and ask for the claim examiner that's dealing with that case, and just say, "Hey, did quality review send it back? Did you check the box, or whatever needs to be fixed, or whatever the case may be? And can you send that back so I can get my money?" So there's inside scoop. I did not get to check in May. That was a fat lie at the government told. I did not get to check. You did not get a check in May. So yeah, if you were missing your May check for whatever reason, then yeah, you definitely need to reach out. They can do an immediate payment out of the office if you really, really need the money quickly. Patrick, my 92-year-old mom got her SSDI cut for 3 months now. She's not receiving SSDI. So she's receiving regular Social Security. They just sent her a letter that won her paid. She has no money. What can we do? Okay, so nobody after their full retirement age is receiving SSDI. Once you reach your full retirement age, everybody has switched to regular retirement benefits. So do you mean SSI or do you mean SSDI? So if it's SSDI, then it switched to regular retirement benefits. So if she got her cut for 3 months now, letter they overpaid. Oh, okay. Not one or owner pay, overpaid. They just sent her a letter they overpaid. Okay. So, yeah, it really depends what the letter says in terms of overpayment, because obviously, she's 92 years old, so it's not a type of issue, because she can, she wants to work, she can work. After your full retirement age, it doesn't matter anymore. Yeah, I'd find out what's going on with that overpayment. And so check out, find out exactly what the overpayment is for. That's number one. And then go into my website, mygovexpert.com, and let me throw up the, where is it? There it is. Okay, let me throw up the little mygovexpert.com, and this is the website. And then click on More on the right there and click Overpayments. And it'll tell you how to address an overpayment, whether you need to file a 561 request for consideration or a waiver, and your appeal rates and all of the rest of it. And, why was I overpaid? So reported income changes. The income changes are only related to SSI, Supplemental Security Income, the welfare-based program. So that's not an issue if she was receiving SSDI at one time. Change in the living arrangement situation, that doesn't affect. That's only SSI. This one, maybe there's some type of calculation error that Social Security did or something. So yeah, at 92 years old, I'm not sure what type of overpayment she received. So you need to find out that to see. And then once you find out what the overpayment is about, come on back and we'll see how else we can help you out. Christine, at 61 and have not worked since 2018 due to taking care of elderly parent. I have diabetes, COPD, and neuropathy. Does that qualify for disability? The Social Security says I don't qualify anymore. So that is currently insured. You are not currently insured. Again, my website explains this a little bit more in detail. Click on the disability there, and it'll tell you what's the difference between insured and currently insured. I actually got a better explanation. Where'd the other better explanation go? Eligibility there. But anyway, yeah, I need to work on that a little bit more. But anyway, so insured, so you can be insured for Social Security disability. That means you paid into the system at least 10 years, usually 10 years, unless you're younger, it's exceptions. But you also have to be currently insured, that you worked 5 out of the last 10 years. And it sounds as though you didn't work 5 out of the last 10 years. So you're not currently insured. But they usually don't make mistakes on currently insured status, the dates of that, because they just put the dates that you allege in the computer system. The computer system does it automatically, and it's always right in that case. But maybe the dates that you're alleging your disability are, if you say, hey, I became disabled, 6 months ago, and they say, well, 6 months ago, at that time, you were not currently insured. But if you said, okay, well, I became disabled 8 months ago, maybe 8 months ago, you were currently insured. So there's different date. It's called a DLI. Ask them what the DLI is, the date last insured. And then you just have to be determined to be disabled before that date, before the date last insured. So I know it's all confusing, but that's the way Congress wrote it. So my son is on SSDI. He was told by his tax preparer that he cannot file for EIC credit. Yeah, I don't do taxes. So, well, I do my own taxes, but I don't even do my own taxes. I have someone do those. So, a person at the Buffalo office has dropped a ball. Can you help me? It was a basic, clean application, 100% straightforward, and I have all of the documents. In Buffalo, New York. Buffalo, New York, I hope, right? Not the one in Las Vegas. It was a basic, clean application, straightforward. I have all the documents. Yeah, it depends what, if someone made an incorrect decision, you have appeal rights. You can file, that request for reconsideration, a super, super easy form to fill out. I've got the link on my website there. And then when you do that, someone else will look at it and see what, make sure the first person made a correct decision. So I've applied for retirement at 64. My ex-husband applied for his as well. We have disabled adult son. He is receiving SSI. So now he has an appointment next month. Why is that? Because he's probably entitled to benefits on yours or your husband's record because you're starting your benefits. And because he's receiving SSI, he has to file. He's mandated to file because SSI is a needs-based program. It doesn't come out of the Social Security Trust Fund. It comes out of regular old taxation. And that's Social Security's job, is to save taxpayer money, the general taxation. So if your son is eligible for benefits on yours or your husband, but whichever one is the higher, then they will have him file what's called the disabled adult child benefit on his or your husband's record. And then that will offset the SSI. So if he's receiving the max SSI, which is $967, and then he's eligible for $1,000 off you or your husband, then his SSI will essentially stop. So, and then because his SSI stops, it really depends on the state. Some states, if he's receiving Medicaid, then the Medicaid, some states, it will continue, even though he's not receiving SSI. So yeah, you need to check that out. So he will get 50%. If there's only one child receiving benefits, he'll get 50%. So whichever of yours is the higher PIA, the primary insurance amount, if let's say yours is $2,000 a month, then he will get 50% of that, $1,000. And that's over the 967. So I would start calling around to Medicaid offices and say, hey, looks like my son is going to lose SSI, and there's nothing you can do about it, unfortunately, because it's mandated that he files for it. So if he loses SSI, will he also lose Medicaid if he has Medicaid? So let's see here. How can they go after fraud and Social Security folks don't have to worry about losing their benefits? Yeah, fraud in Social Security. Social Security has passed all 31 of the previous audits with flying colors. And fraud does exist in Social Security. It's people, working that are not supposed to, and people that got better and can work, and people that are receiving SSI. So that's where the fraud is. But it's a one-on-one case. It's just one person over here doing this thing they're not supposed to, another person over there doing this other thing they're not. So it's not 20 million zombies receiving Social Security benefits. So that's what Doge was going in there to make headlines. Bureaucracy is boring. Yeah, it's just one person at a time getting a tip from someone that says, hey, this person is working. Hey, this person is actually deceased, and they're in a 55-gallon drum in the storage down there, and happens, obviously. That's what it is. A one-on-one case. So they were looking for splashy, sexy headlines, and we know that, nothing happened. So again, if you disagree, go into the Doge website, the wall of receipts, and show me where the fraud was. They just didn't found it. They weren't looking in the right places. So, okay, I already answered that one. We're getting close to the end here. Oh, we got a donation. Thank you. Appreciate it. Thank you, Christine. $4.99. Thank you very much. Got my son and I got our coffee IVs for the day. I appreciate it. I'm 61, diabetes, rugby, COPD. Playing rugby on COPD with diabetes. Wow. Must be a Samoan or something, right? They're all black New Zealand or something. Social Security says not eligible for disability. Now, took care of parents. What can I do? Oh, okay. So I think that was basically, the same type of thing. You're not currently insured. So you have to fulfill both of those. You have to be insured and currently insured. So let's see here. Get some other. We've got one or two more questions time for. Let me see if I see anybody that I've never seen here before. If my husband passes before me, how much of his Social Security will I get? I am 75. He is 90. I might go before him. Only God knows. Yeah, nobody knows. Nobody's got that crystal ball. So survivor benefits. So you are both past your full retirement age. So whichever one is higher. So let's say his benefit is $3,000 and your benefit is $1,500. So what will happen is you will receive $3,000, but your check will kind of stop. Technically, it won't. Basically, you'll continue to receive your $1,500 plus an extra $1,500 from your husband. So for a total of $3,000. So this is where a lot of people, I always hated telling people with this when they came into the Social Security office when they were, filing for survivor benefits. I said, yesterday, last month, total money coming into the house from Social Security was $3,000 plus $1,500. So that's $4,500. starting this month, no, it's only going to be $3,000 because you essentially lose that. One offsets the other. So a lot of people think, oh, when my spouse passes, I'll just get that check, and of course mine will continue. No, unfortunately, it won't. It will, but again, just the way the calculations are done. So one day you got 4,500 coming into the house, the next day 3,000. So, and then so if it depends, and there's also that embarrassingly low lump sum death benefit, the $255. So even if you're not entitled to monthly benefits on that record because yours is higher or his or whatever, then you're still eligible for that $255. So. All right, let's see. I don't recognize Andrew. I don't think I've answered any Andrew's questions here before. I have reached the age of 70. Congratulations. Will my Social Security increase as long as I continue to work? Yes, if your work is one of your high 35 years of earnings, because they determine your benefit amount by what you pay into Social Security, and then they look at your high 35 years of earnings. So if you're 70 years old, continuing to work, 80 years old, 90 years old, 100 years old, you continue to work and to pay into Social Security. If that's one of your high 35 years, Social Security increases your benefit amount, and it's 100% automatic. You don't have to do anything except for talk to your friends at the IRS and file taxes. So, $9.99. Wow, thank you, Christine. Take my now Social Security. Okay, not eligible. Yeah. So this is the kind of the same question about you. It sounds like you're not currently insured, but if you think you might be currently insured, again, you had to work 5 out of the last 10 years before you became disabled. So it's not effective today. If you say you became disabled a year ago, then from a year ago, 10 years back, sometime in that 10-year period, you had to work 5 years, and not, all together. You could have worked, a quarter here and a quarter there and a year there and, a month there, but it all had to equal 5 years out of the last 10 years. So if you disagree with, again, this is the DLI, the date last insured, then file that request for reconsideration and say, hey, I think I am currently insured. I think you calculated my date last insured incorrectly, because remember, I did become disabled effective whatever date. So that's the date that they're going to use to determine your date last insured. So maybe they put it in wrong. If you say, okay, I was disabled effective February 1st of 2025, and then they type it in the system, they say, well, yeah, your date last insured was January 31st. And then we're like, well, if it was like an accident, a tragic accident that happened on February 1st, then yeah, that's it. You can't change it. But if it's a non-traumatic disability that you've been dealing with for a long time, did it really happen on February 1st, or did it happen on January 31st? And then if you call them up and say, it wasn't a tragic accident, it was non-traumatic injury, disability, it happened, January 31st. And then they type it in the system and say, okay, yep, you are currently insured. Let's go ahead and continue on with it. So that's an important fact that hopefully they messed up. Hopefully they got the wrong date. And yes. So hopefully, yeah. Oh, got some more donations here. I appreciate it. You guys are awesome. A big shout out to the Social Security office in Boston. With all the staff cuts, I decided to apply for my benefits a bit prior to 70. I put in my application in April and got my first deposit last week. Awesome. Awesome. Boston. You guys are too good out there. So shout out to the Boston office. Even after all the craziness, you still got dedicated employees out there doing the right thing. So follow up on the DLI. I have not been diagnosed disabled, but I've been living with disabilities since. Yeah. So yeah, the diagnosed disability. So Social Security has different parameters for disabilities. So you just file for benefits. If you think your disability prevents you from working, and your disability is going to last 12 months or longer, then file. So, all right. We're way over, and I'm sorry I didn't get to all of the questions there, but I will be back again tomorrow, and we'll come up with another topic of the day, and then help you out with all your questions. And in the meantime, you all take care of each other, and please, please, please take care of everybody out there. Take care.